Hi, my name is Katie Rietta, and I am an application specialist with DermaSpark. And today we're going to be talking about the TriLipo technology. TriLipo is a well-known and well-documented treatment for all types of conditions, mainly skin tightening, circumference reduction, and cellulite treatment, and even muscle toning. The device has 3 different applicators for all, so it treats the whole entire body, small areas with the smallest handpiece, which is the number 3 handpiece. You can do eye lifts and facial contouring with this. We have the medium size, which is for bulk heating on the face, and it is great for underneath the throat area, face, arms, in some cases even small waistlines for someone that's really petite. We also have on it the body contouring handpiece, and this is what you'd be using if you were going to be doing some kind of cellulite application or circumference reduction on the tummy, like mummy tummies, etc. Now, what is the big deal about TriLipo and what sets it apart from other radio frequency platforms? Well, as TriLipo suggests, there's 3 different means of or modalities used by this platform to improve the texture and tone of skin. Number 1 is tripolar radio frequency, and that type of radio frequency is the latest type of radio frequency. The reason why it was called tripolar is because the earlier models of the tripolar had 3 poles, and you have all engaged at once, 2 negatives and a positive, and it's sort of the algorithm changed polarity, so the energy almost went around almost like a beater-ish. Because the poles were set so close together, it sort of created what's called magnetic resistance. So compared to your traditional bipolar radio frequency, which is the depth of penetration of that is about 50% of the distance between 2 poles, this we cast the energy a little bit deeper. That given there's all the poles are engaged at once, it's always self-grounding. Other RF technologies like bipolar, for instance, if there's just 2 poles and you lift the negative up, or if they have uneven application, would spark a person. It feels like a shock. With this, because you have everything engaged and there's 2 negatives engaged at once, it is self-grounding, so I can pick it up, put it down, pick it up, put it down. Very, very comfortable and no shock. It's very hard to move it in a manner that it would cause a shock. So it does beautiful heating on the skin, and it also, because it's doing a little bit deeper into the fat, it's really great at melting down triglycerides in the adipose tissue. So typically, these 2 handpieces are used on the face, and of course you don't normally want to melt fat on the face to devolumize. You're just wanting to tighten the skin. So typically a protocol for that, you're looking at maybe 40, 41 degrees. You don't want to get too hot because you could melt cheek pads, and I'll show you how to do that later in the video. Also on this technology is what we call muscle activation. When we're doing body contouring, we want not just to tighten the skin, but we also want to tighten and tone. So muscle activation, it's just as it suggests. We use this handpiece, for instance, and again, you see these poles really nice together, so it creates a really nice condensed uniform heat. Because of the magnetic resistance, it's going to go a little deeper into the skin, but it's also going to create this electrical pulse which causes muscle contraction. What happens is, instead of a lot of other cellulite technologies that might use vacuum to mobilize the fat that we melt, this here uses muscle activation. So your muscles start contracting, and that not only tones the muscle, but it also creates a really great lymphatic drainage and really good blood flow into the area. So we're using our handpiece, we're tightening the skin, That energy is going deep into the adipose tissue. We're breaking down the triglycerides into free fatty acid and glycerol, and then we're going to create this electrical pulse, which is going to be basically mobilizing all that fat that just recreated. So how does that work for circumference reduction? Well, obviously, if you tighten the skin in the back, I mean, you're going to look firmer and better, etc. But by mobilizing that fat that we just melted, we're basically making our fat bioavailable to be used as fuel. When we're eating, if we're on a diet, calorically restricted program, we start burning fat, but we might burn fat here and there all over the place. We usually end up burning it everywhere else than where we want it to be taken off. We'll lose it on our face, and we'll lose it on our chest and everywhere else, and then but would really want it on their stomach, for instance, or our thighs. This is melting the fat where we want to lose. So that is the fuel that we're going to be consuming. Basically, our body's going to be burning that as fuel. So when you're doing these kind of treatments, it's always recommended watch your caloric intake. You don't necessarily have to go on a diet. It really depends on what you're looking for a result. But for instance, if I'm trying to lose middle weight and you have a nice high protein complex carb, like lots of salads and stuff like this program, you're going to be releasing the triglyceride, the free fatty acids into our bloodstream. You're going to be eating healthy with low sugar, low carb, and this is what you're going to be burning for fuel. You're going to be burning your tummy. So it's going to work really great with your healthy lifestyle program. So now let's talk about some conditions that we can treat with this device. Well, as mentioned before, we can do an amazing facelift, skin tightening treatments with this particular platform. Normally, because we're just trying to tighten the skin when we're doing the face, we're usually just wanting the temperature of the tissue to be roughly about 40 degrees, maximum 41. The only place on the face that you want to go a little bit higher is someone's trying to lose volume underneath the jawline for double chin, or maybe someone's really a heavier face and they have a lot of jowls here. You might want to have this temperature here read about 42. Typically it's less, but you can do, my method of treatment is typically have the client rotate their skin sideways, face sideways when you're doing the treatment, and I treat the jawline here with the handpiece, and I'm going back and forth until I reach that happy temperature, about 41, 42 degrees. When I'm coming up to continue on the side of the face, I come up right before the ear. And why I do that is because there's no jawbone, right? So it's a really nice transition up from here up to the side of the face. It's an L shape, but it's really almost like a distorted figure eight, because we're doing loops. You never want to go back and forth with radio frequency, or else you're going to get hot spots. Some areas are going to get too hot, some areas are going to be missed altogether. So to have the best heating, sort of do a loop, ground, and loop around, and then you're doing this. So you're just basically doing this kind of pattern and holding that. Just, you can go down into the neck if it's getting too hot, and you're going to have a very nice whole pull up backward to the side. And then, because I really don't want to melt the fat pad of the face, I typically hold their face, and it keeps the skin nice and taut, so it has a better slip to it. So I hold it here, and I'm doing almost like an L. I think it was Dr. Patrick Bitter that once referred to that as doing a vector. So we're doing the sides of the face almost like an L. So we're doing a nice pull back on the tissue this way. So we're heating up here. Sometimes I have a runoff down to the neck. You always have to avoid thyroid when you're doing radio frequency treatments. Then from here, you can easily go up onto the forehead. Normally, I will have them with their, obviously with their headband on, and I'll push down on the headband so this has a little bit more meat to it. So if I'm coming up in the forehead to heat, the area, it's much more comfortable for those poles to go on the forehead. It's very bony, especially some clients that are really thin and want skin tightening only, to run those poles just on them. So just doing a little compression, thickening up that glabella area and the lines here, the corrugators, just to give a little bit more density to the tissue. Is going to be really much more comfortable for them, and you're going to heat up a little bit better. Now, after I've done this half of the face, I flip them over and do this half of the face identical, and what I'm doing is I'm heating this up again. So as you notice, for the entire treatment, I'm heating or maintaining the heat underneath here. And why? Because this is the only area that we really want to melt on the face. Everything else we just want to tighten, but here we typically want to melt, or at least really firm up, because this is sort of controlling the jawline and the whole jaw area. So you start here again, you start working back and forth like this, then you're working back up like your L, and then you're eventually doing this like forehead, this, and back down, like you're just doing your patterns like this to do the whole maintenance. Normally I'm doing about 10 minutes per side of face. Now, after you've done your 20 minutes of radio frequency, and again, we're going to be showing this live soon. I just want to talk to you and describe it before we go through it and why I'm doing this, because sometimes even on videos when you're looking at a live demonstration, you can't see all the details. So after I've heated up the entire face, I switch my handpiece. This is the handpiece that we're doing that treatment with. We switch from the number 2 handpiece back to the number 3 handpiece. And why? Because I like to do my eye lift with this. So I've heated up generally the entire face. Now I'm going to use my number 3. I love it because it's so extended. I can really see where my poles are. So typically when I'm doing this eye treatment, I'm normally going right along the ocular bone and up. So I'm doing almost like a big C. I don't have to worry like with the oxygenale going down under the eye very much, because I've already heated it with the bulk heating. So with this, I'm just concentrating on the eye. I'm going up on the eye area, over the brow, and then back, almost like a C pattern. And always make sure you're on the ocular bone. So I'm going tear trough, eye bags, crow's feet, brow lift, and I'm just coming back just lower. Never go back and forth. Always make sure there's a little bit of a gap where you're just going parallel with your poles. So this is going to do a nice eye treatment, and that is really going to finish your facial. Now, if you want to add even more zoom to that facial, you can change this handpiece here to muscle activation only. And what does the muscle activation do for the face? It creates what's called smooth tightening. So you can have the RF on low. You don't want to get it too hot because you don't want to devolumize the face. But you can just sort of do the trajectory here where all of the fascia that holds the muscles that has gone, slack over the years. And we're just going to be doing muscle activation on this area, and do it quite slow, low RF, and really repeat it. And you'll probably do about 5 minutes per cheek. What that is going to do, it's going to cause muscle activation for the face. It's going to cause irritation of the fibers of the smooth, and it's going to cause a contraction. And that is awesome. If you ever check with a plastic surgeon when they're doing facelifts, for instance, what do they tighten? The smooth, because everything is connected to that. So using the muscle activation with low RF or no RF, so you don't devolumize the cheek, is really important to add on to do with the TriLipo facial as well. So now we're going to do a stomach body contouring treatment, and I just want to go over a few things before we start. When we do radio frequency with the TriLipo, we always use a high quality glycerin. I just use the Life brand, because we checked it out and it was over, I think, 94-95% glycerin. I personally prefer using a small bottle of glycerin, and I'll tell you why. Glycerin, just the nature of it, absorbs moisture from the air, and it will literally start to dilute itself. So if you have a glycerin and you leave the cap off all the time and things like this, just the humidity, and it's very humid in Toronto right now, the container of glycerin will start to absorb water and actually reduces the efficacy of the glycerin. It becomes a bad conductor. Water has too much electrical resistance, and it's bad for the machine, and it is very bad for the client. They'll feel it. So it'll feel really hot and superficial because it doesn't bypass that conductor into the tissue. So always make sure you have a really good quality glycerin. I prefer to have a small container, and when I'm getting low, I just toss the container and get to a new one. I don't like using product that's been opened too long on my clients. So always make sure you're using this as a conductor. No other conductor is allowed with the TriLipo, just a high quality glycerin. So we're going to start our stomach treatment today with the TriLipo. To start your machine, there's this switch in the back. You just power it on, and a dialog box is going to come up to the top. Just give it a second to power up here, and it says first it's going to have you choose your language. So choose the language of your choice. I'm going to choose English, and then it's going to say press the biofeedback, which is this. This was always considered a safety switch for any, the same thing as we have on lasers. If something has to be shut down in emergency, you can hit the biofeedback. To start it, you can just hit this, and we are ready to go. It's going to ask you, do you want to put a code in? It is possible to set codes for this so you can limit people who use it. I don't have a code on mine, so I'm just going to hit no. Now I'm going to choose, it says 2 applications, and if you look on the side, you're going to see what that dialog box looks like, and I am going to choose the large handpiece, which is applicator 1, and I'm going to press the button, and it's going to give me a choice for buttocks, lower buttocks, which is doing a butt lift, and thighs, stomach, muscle, and I am going to choose tummy, because that is what I'm treating today. Then we have our next dialog box that comes up, and in it shows time. For a regular stomach treatment, it's usually anywhere between 25 to 35 minutes. Again, the protocols that are preset on this machine are conservative. Lots of times we're bumping that up a little bit. So 25, if they're more petite, thirds on my size, I need about 35 minutes. I could even probably do more than that. But so we're going to go 25 to 35 minutes. I'm just going to go 25 on Kara today. For radio frequency, my happy number is I'm usually at about 50%, 55, somewhere around that. It is not recommended to go too hot, and I'll tell you why. If the hotter the poles are, the faster you have to move it. When you move the handpiece too quickly, it's very similar to when you put a hand through a candle, right? It doesn't have time to really take that heat and absorb deep into the tissue. And what I'm trying to melt here is adipose tissue. I don't want some superficial treatment. I want to get really into the fat of the tissue and break that down. So actually, in this case, less is more. I've seen people with, jacking it up to like 90%, which is so hot, and they're moving it like crazy, and the only person that's losing fat is probably the technician because they're overworking themselves. So don't go high on this. It's bad on the machine too, because having that kind of extended power over an extended period of time isn't great for the poles. So a lot of people say, well, how come it has that capability? Well, your car can probably go 180 kilometers an hour. It doesn't mean you're going to drive it at that, right? So always keep it around 50. If you need to heat up the tissue, instead of raising the radio frequency, you can just slow down your motion a little bit. And as it becomes warm, you can increase your motion and increase the speed of your motion. So 50 is sort of a sweet number. 55 if it's a larger area, possibly even 60. I don't typically have a tendency to go hotter than that. So I'm going to go 55. I'm going to hit my OK button. I'm going to go down to my pulse width. Well, what's pulse width? Pulse width is the duration of the contraction, if you will. This is the next 3 features are all dealing with the actual muscle stimulation, and that's really important when you're dealing with an abdomen. It's really important when you're dealing with any part of the body other than actually any part of the body. So when a pulse width, 160, is sort of like a shorter pulse width, versus like 300 or 400 contraction is a really strong, long contraction. So typically For smaller muscle areas, like all the little all the smaller muscles of the abdomen, I'm usually using a little bit more conservative. It starts at 160. I'm normally doing probably about 240 because I like a little bit stronger, a little bit more of a contraction than 160 would allow me. But you can go all the way up, and it's to client's tolerance. When I'm using the TriLipo on the buttocks or a bigger muscle group, I go way up. I'm like 300, 400 even. So I'm way off the charts with a bigger muscle group because I want a really nice, strong, muscular contraction if I'm doing thighs and I'm doing a butt lift. The next, I'm going to save it at 240, so that's pretty standard for a stomach. I could have done 280, probably would have been very comfortable. The next is hertz. It is the frequency. You have 0.7, this is how many pulses per second. 0.78 is far too slow because when you're moving it, I might be only contracting here and there. It's not going to be contracting very often. If I'm doing it up to 1.56, I'm getting 1.5 contractions per second. It's not bad. That's usually where I have it, especially on an abdomen. You can move it up a little bit more if you're doing a larger area and you're speeding it up. You need more contractions because you're covering a larger area. So I'm going to keep it at 1.56, and that's normally where I start a client anyway. Then on the bottom of this it says press the foot switch to operate. So I'm going to hit my foot switch, and you're going to see TriLipo power over on the side. I'm going to start that at about 20. And just like when you're at a chiropractor's and they start the TENS machine on you and it feels really kind of uncomfortable at first, but as you're talking and you're used to it, they can jack up that intensity quite a bit and you just don't even feel the difference. That's kind of like my TriLipo power. That's the intensity of the contraction itself. It's the power behind the contraction. Normally I start off low, and as I'm talking to the client, I just boot it up by about, increase it by about 5 points during it. So I might end up on the stomach like 45, 50. In some cases on the stomach it can be significantly stronger than that. On bum lifts and thighs, bigger muscle contraction groups, you can raise it really high, like 80, 90, even 99%. It's all on tolerance on the client, and of course their first couple of treatments they may not tolerate that, so always work with your client. If they're sensitive, don't do it so strong, but you can move that up usually as they progress in treatment. So now we're going to start on the abdomen. Just make sure that your glycerin is applied very thoroughly all the way around. I like to be quite liberal with it just to make sure that the client's really comfortable. Only use a high quality glycerin. Make sure that it has not been diluted in any way. And just to be on the safe side, I even take my handpiece before it's on and I just do some quick massage on the client just to make sure my glycerin is evenly distributed and make sure there's no dry spots. If you ever hit a dry area on the client while the radio frequency is on, it could cause a superficial burn. So I want to avoid that. Wouldn't be serious or anything. It would peel like it'd probably just first layer like a sunburn, but it'd be uncomfortable for them and they would not be happy. So always make sure, just this way, my poles are nicely oiled not oiled, but with glycerin on them. And so even if I hit, it's like a little bit of insurance. It's always lubricated well. So now I have my settings that we just went over, and I'm going to hit my foot switch. You're going to see the handpiece turn orange, and I'm going to start my treatment. When I first start my treatment, I'm usually holding it. As you can see, I don't do a wrist hold like this because people have a tendency to tip the handpiece too much when they're holding it like this. Plus, it's really bad for your wrists. So I'm usually holding it like this with a good grip, and I just sort of relax the weight of my arm on it so that you really don't see the poles. It's really nicely enveloped into the tissue. So I'm going to do huge, nice, big circles. What I don't want to see is I see clients and they're doing this. Well, that's almost like the handpiece is standing still. And I don't want to see dipsy doodles or, when you're seeing the handpiece the whole handle of the handpiece straight up and perpendicular to the tissue, you know you have really good contact. So nice, big, deliberate circles. Don't do small circles, and you're going to be really super repetitive in the same area until it gets to temperature. And I always ask for client feedback. So how does that feel?
Feels good.
Feels like a nice hot stone massage.
It does. Feels like hot stone.
And can you feel the tingling of the muscle activation?
I can. I like it.
Are you comfortable? Can I raise it?
Yeah, you can.
So she's already comfortable at the setting of 20, so I'm going to increase it up to 25. It's a little bit stronger.
You can feel it.
And I'm going to slow down a little bit because she's not heating up too quickly. Again, I use a conservative radio frequency when I'm doing these treatments because I really want to be repetitive and layer that heat deep down into the adipose tissue. So now I'm going to take a temperature. And she's at 43.5, which is really nice for fat reduction, and also does a great job of skin tightening. I usually maintain the heat in the area a little bit longer, and then I'm going to move, I'm going to increase my pathway and incorporate the sides as well. So now, because I'm warm here, I'm just going to do a big circle, and I'm going to start increasing my area. Always maintaining where I just heated. You don't want to let go of that heat. So I'm going to just do some big circles here and get down into the waist a little bit. And basically that is it for your abdomen. You're going to continue this pattern, just big circle, big circle, big circle. Back and forth until your 35 minutes is done. Always be careful of the ribs because it's a little bony and too much pressure can be irritating there. The better that you can move into the sides, you're going to have just a better result because you're going to increase the curvature of the waist by tightening in those areas and reducing fat. Now for aftercare, the client should try to reduce her carbs and, please don't eat sugar, etc. Because if there's a lot of sugar in the bloodstream, it's going to use that up before it uses, your body uses the FFA. And you can see the size of the circles. I'm really maintaining heat over a huge area. And it's not spiky heat with the client. How does that feel?
Feels really good.
Feels like a hot stone massage. Mm-hmm. And again, I can increase her muscle activation up, and she probably doesn't even feel the difference because she's getting used to the muscle activation. And that is how simple body contouring with the TriLipo is. And just for good measure, I'm going to take another temperature. And she's at 42.4, which is great. So just continuing with the body contouring, there are a few tips that I would like to share with you today. A lot of times people are coming in and they really need more skin tightening than they do fat reduction. And in a case like that, I'm usually using treating a larger area, and I'm not treating it as hot. So in the case of someone that has crepey knees, for instance, I won't treat the knees because that's just the slack tissue, and it's just almost like pulling down socks. It's from the loose tissue, and you often see this with runners. loose tissue of the legs just sort of collapsing and drooping a little bit, lots of times from the percussion of running, for instance. In a case like that, I would just do a large area and just heat it to about 40 degrees. And I literally take it all the way up from the knee, all the way up the thigh, almost up into the hip area. Why? Because it's almost like pulling up socks. I don't want to necessarily have a really intense heat to break down more fat, because that could even make them look crepeier. So sometimes we're tweaking our services depending on the client's needs. If someone is really fit but had a child and her stomach is really loose skin, well, I might not have it treating at 22 or 23 degrees. I'm going to be treating it maybe at 40, 41 degrees. I want to do more skin tightening in a larger area. And those kind of treatments, I often have them further apart, because I'm, again, waiting for each contraction from each treatment to take place and waiting for that new collagen to be produced, etc. So skin tightening lots of times takes a little bit longer to develop than just fat reduction. So I can, for someone that just needs skin tightening on the body, I would lower my temperature, do a larger area, and sort of tweak my timing to have larger intervals in between treatments. If they really need circumference reduction, I'm going to make sure that I'm hitting those 42, 43 degrees Celsius temperatures, and I'm going to really concentrate that heat in the area of concern, and I'm going to do those treatments weekly, because I really want to sort of melt down that fat, reestablish that really good microcirculation in the area while I'm firming up the muscle as well. If someone needs muscle firming with the TriLipo, you wouldn't necessarily do that once a month, would you? Because it wouldn't really, if we were only working out once a month, it wouldn't really work very well. So for skin tightening, maybe once a month over a longer period of time to allow that really good contraction of tissue. For body contouring, once a week. And the big question is often people say, well, can we do multiple body parts once a week? Not really. If I usually limit my treatment time to about an hour. If I was doing a huge area, if someone wanted thighs, a lot of fat in thighs, right? If someone wanted a thigh treatment, an abdomen treatment, I would try to stagger those treatments, only because your body's only going to deal with so much FFA. I'd be melting down the fat and releasing it in the bloodstream, and really, are you really going to use it? No, it's almost like a wasted treatment. You're gonna, your body will probably just repurpose that fat and put it someplace else in the body, which we don't want. So typically, I'm limiting my treatment time for circumference reduction to about an hour maximum, because that way your client would be able to utilize the fat that we just released. If someone is coming in for skin tightening, on the other hand, I don't care. I could treat them all day. I could treat them for hours. I don't care, because they're not going to have to metabolize the fat. I'm only going to be hitting 40 degrees, 41 degrees, so I can do a larger area. So again, how you time the treatment, typically fat reduction once a week. Skin tightening, I usually do it further apart to really maximize the efficacy of each treatment. And another little tip, if I'm doing thighs, I typically have them stand up, especially if they have cellulite. I'll take a white crayon and I crayon off where their cellulite issues are. Why? Because when they're lying down, sometimes they just disappear. I really don't see where I have to focus. So if I chalk them off with white crayon and or white eyeliner works really nice as well, I can lie them down, and the area of the concern is exactly like if it's on like saddlebags, for instance, on the thigh. If I'm heating that area up to 42, 43 degrees, from that area of heat, I start working out and incorporating a larger area group. So this is sculpting. It's not, we don't just do the entire area like the whole thigh or something like this. We're doing the areas of concern. So always focus on the targeted issue, work as far as possible into the other areas or surrounding that area, but always maintain heat in the cellulite, for instance, the cellulite issue for the entire length of the treatment if possible. And you would do time both thighs like that. Or if someone needed, like wanted thigh gap, they have a buildup of fat in between their thighs, you would start the treatment there and then work out from that to other areas. In some cases, what I've done, I will treat the cellulite on the saddlebags, for instance, and in one treatment, I'll do the front of the legs, there's not a whole lot of cellulite there. They just needed some tightening. And the next treatment, I'll do the same area, but I'll have them on their front, so you can treat the saddlebag and then go down the back of the leg. That's another nice idea, so that they're having basically skin tightening on the whole circumference of the thigh, but you're really concentrating each and every treatment on the area of concern when it comes to cellulite. Always, if you're treating cellulite or fat reduction, make sure that your muscle activation's on pretty high on thighs. We're like yanking it right up there. It's often like 90%, 99%, something like this. So again, when you're doing the bigger muscle groups and they have a really good contraction, you're going to have better blood flow into this area of cellulite, and good muscle up contraction, you end up with better fat reduction in the area. Anyway, we at DermaSpark, we are always here and available for training tips and suggestions, and we have training available at our offices on a regular basis. So feel free to reach out with any questions you might have. If you have new staff training, if anybody has any questions, please feel free to contact us. You can get hold of me through the head office if you don't have my contact details already. And we'll be happy to see some of your before and afters. So take care. Let me know if you have any questions with any of this, and we'll be happy to help. Talk to you soon.